The Integrated Model for Supervision, or the IMS, has been made possible through the generous support of USAID. It's a collaboration between IFRC's Reference Center for Psychosocial Support and Trinity College Dublin. The project came around because there was an understanding that supportive supervision was a missing link within mental health and psychosocial support in humanitarian settings. The Integrated Model for Supervision team came together and in their first year learned as much as they possibly could about supportive supervision in humanitarian settings. Through a desk review, key informant interviews, regional workshops, a Delphi consensus building study, and other activities, we learned what works best for supportive supervision and what the key challenges were. This resulted in the Integrated Model for Supervision Handbook, version 1. This handbook was then turned into a training curriculum and piloted through 4 different countries. Because of COVID-19, these trainings were done online. We worked with Ukraine, Afghanistan, Jordan, and Nigeria. Through our online trainings and follow-up supportive supervision and implementation consultation, we were able to learn a lot from these organizations. The IMS project team uses a participatory action research process to continuously develop their products and tools to make them as applicable as possible. The next phase of the Integrated Model for Supervision was using the revised IMS handbook and developing accompanying tools to go with. We developed the Integrated Model for Supervision Adaptation Guide. This adaptation guide comes with the understanding that the IMS is not a one-size-fits-all approach. It's necessary to adapt to fit the culture, the context, and the organizational environment to ensure that it's as appropriate and applicable as possible. In addition to the adaptation guide, we developed a monitoring and evaluation guide. This is to help organizations to determine what success looks like for themselves when they're thinking about the impact of supportive supervision. They may wish to consider areas such as staff and volunteer turnover, well-being, the knowledge, confidence, and skills of providing mental health and psychosocial support activities. All of these can be considered for our monitoring and evaluation guide. We then took these resources and tools and we did a pilot test in Ethiopia and Bangladesh. Within these contexts, we were able to do the trainings face-to-face. So we were able to see both what the Integrated Model for Supervision training did remotely and face-to-face, which helped us to develop training materials and tools that could be used in either environment, helping us to make it even more accessible. Again, using that participatory action research methodology, we learned as much as we possibly could. Throughout all of these years, Trinity College Dublin has been collecting data about the impact of the Integrated Model for Supervision, how it impacts people's and organizations' knowledge, confidence, and skills about supportive supervision, their well-being, their turnover, also doing qualitative interviews to understand exactly what the IMS is doing and what the key challenges and barriers might be to implementation. This has resulted in several publications throughout the years, including gender consideration studies, case studies on acute emergencies through Afghanistan and Ukraine, as well as several different publications on best practices for supportive supervision within humanitarian settings. All of the resources for the Integrated Model for Supervision are available on our website, www.supervision/mhpss.org. Here, you can access all of our resources, including the IMS Handbook, Adaptation Guide, Monitoring and Evaluation Guide, as well as an advocacy toolkit. All of our peer-reviewed publications are also freely accessible. They will be continuously updated as the IMS team learns more and more about the applicability and the appropriateness of the IMS in humanitarian settings. In addition, you'll see who we are as an IMS team and know how to contact us should you have any questions about using the Integrated Model for Supervision within your organization. We also have a community of practice. This is meant to be a supportive, interactive space where those who have been trained in the Integrated Model for Supervision might be able to connect with others to share their successes, challenges, resources, and hopefully collaborate with the eventual goal of promoting supportive supervision globally. As the integrated model for supervision enters a new phase, we're excited to be translating the tools into Arabic, French, and Spanish. We will then do training of trainers to scale and roll out the integrated model for supervision. We're very excited to be welcoming organizations from across the globe to Copenhagen in November of 2023 for an interagency training of trainers. And we're very much looking forward to this new phase for the IMS.